in response to the Nipah virus outbreak in Kerala, the Karnataka government has taken proactive measures as well. They have issued a circular to enhance surveillance in the border districts, and this, of course, to prevent the virus from spreading across the state lines. Karnataka is bolstering its monitoring efforts, and this move underscores the urgency of the situation and the need for vigilance in the neighboring regions. Now, the government is focused on early detection and containment to safeguard public health, and meanwhile, Rajasthan government has also alerted its medical officials in wake of the Nipah outbreak. My colleague Deepak continues to stay on with us. Deepak, this of course is an outbreak in Kerala, and while all efforts are being made to ensure that the outbreak is contained, Karnataka is also now bracing for a potential spillover into its own border. So what exactly are the efforts that the Karnataka government is undertaking, and are there any sort of a detection mechanisms that have been put in place on the border districts?
Well, with the growing cases in Kerala, the district health officials in Kozhikode in particular are doing everything that they can to contain the virus, also trace the primary and the secondary and tertiary contacts of, the people who've already been tested positive. Some of them are receiving treatments at the hospitals there as well. Now, while the health workers are being trained in Kozhikode to, combat this virus and also remain cautious themselves, the neighboring states are also taking necessary precautions. The health department in Karnataka has issued advisories to the people to, avoid unnecessary travel, especially to parts of Kerala where the Nipah virus has been detected, namely here Kozhikode. Apart from that, surveillance will be increased at the border areas to check for people who could have symptoms, and more importantly, they're also asking all of the health workers to be prepared. Training them is something that's on the agenda as well. They're also, asking all the health department in particular to ensure that at the PHC level as well, be it the health workers being prepared as far as what would be the line of treatment that needs to be given, or how to take precautions themselves, and also to ensure that all sort of equipment, including PPE kits and other medicines that would be required to, fight, or the line of treatment that would be required to be used in this particular case for, tackling Nipah, is all in order. So that's the advisory that has been put out. Now, it's not just Karnataka, of course, that's bordering Kerala. Any other state as well are being told to ensure that necessary precautions and steps are taken so that the virus is contained and does not spread across the state borders.
Absolutely, Deepak. Thanks a lot for getting us all of that information about the efforts being made by the Karnataka government and also the other states bordering Kerala to ensure that the outbreak does not really spill over into their borders.